despite the circumstances right now, I still want to be treating my patients. It doesn't matter that there's a pandemic going on. I want people to feel better. I want to be with my patients. So I'm really able to get my hands-on experience that I really need to be able to succeed out in the field.
There's so many things you can talk about and understand cognitively about, certain treatment techniques or patient presentations, and then there's another thing to be able to implement it in person, have these psychomotor skills that they need so much.
It's honestly great to see everyone again, and it feels like such a welcoming community. Everyone is out to protect each other and for safety, and we're just here to help the patients. So it's a good feeling with everyone being back after being gone for so long.
Patients have been great. They've been very responsive to it, and I think it's largely because of the protocols that the staff and the university and our clinic directors have put in play to make everyone feel comfortable with what we know we're supposed to be doing.
It definitely was breaking a sweat. I'm definitely in it to win it. I gotta get back on my feet. This facility I heard is the best one, so I definitely chose this one, and I like the staff members and how they help out and stuff like that. They're real kind and professional. So
my whole family has had physical therapy at the University of Delaware over the last almost 3 decades, so I wouldn't really think about going anywhere else.
I do feel the energy that they are caring and want to see people progress, and I'm sure it makes them feel good too to help somebody out, to sit here and be like, yeah, I helped them out, get stronger, and now they're perfectly fine, like nothing happened. That's what I'm trying to get to.